Three steps on how to pass. Three steps on how to pass the NCLEX are in question banks. You need to do a lot of questions. I can't reiterate that the most. Questions are very important. You need to be doing at least 50 questions a day. Particularly what I used was UWorld. UWorld is very, 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 very helpful. Very detailed. I did UWorld for 2.5 months, and that's pretty much the only thing I use for 2.5 months as far as question bank to pass the exam. I use NCLEX mastery tool as well in a lesser capacity, just something I do on the go, on the train, before I go to bed, nothing serious. So as far as question banks, UWorld and NCLEX mastery. Second step, let's move on to immersion. So the next point I want to talk about too as well is immersion. So what I mean by that is that when you're trying to learn a new language, you don't just study the words, you don't just study the vocabulary for 2 to 3 hours a day and then you expect to learn a new language. You immerse yourself in the whole culture. You talk to people who obviously speaks the language that you're trying to learn. You listen to music, you watch TV, and that's basically what I'm trying to get at. So learning the NCLEX is learning how to pass the NCLEX is pretty much immersing yourself in NCLEX content. So you're immersing yourself in questions, you're immersing yourself with the content. You're not only studying and doing questions 2 to 3 hours a day, like every chance that you do get, you try to familiarize yourself with more content, more questions. So you study, for instance, if you set a goal to study 2 to 3 times a day, you simply achieve that goal, but yet before you go to bed, you're still doing questions. When you're on the train, you're doing questions. When you're driving, you're still watching videos on pathophysiology or something that's going to aid you in something that's going to help you to pass the exam. So it's immersion. So it's not just studying 2 to 3 hours a day. You're immersing yourself in a particular content where when it's time to do the exam, you're totally confident knowing that you know so much. There's no way that you're gonna fail. All right. So the last thing I want to talk about is knowing what to study. We talk about immersion. We talk about questions. You basically do a lot of questions, and then you immerse yourself in the questions. Now let's talk about a little bit about content and like stuff that you really need to know. So as far as the NCLEX, there are certain questions, they're called priority questions, that you need to know how to answer. So certain scenarios where they're gonna give you certain clinical scenarios where you have to figure out what to do first. If you go in a patient's room and the O2 sat is 80% and the blood pressure is like 150, 160 over 100, what do you prioritize first? Do you call the doctor to get medication to lower the blood pressure, or you're going to be more concerned about the oxygen? Obviously, in that scenario, it's the oxygen is 80%. You know, the patient could have a PE. Oxygen sat shouldn't be that low, so that's going to be your first priority right there. And those are really questions that's going to really propel you in the NCLEX and bring you to those more high level questions, so you don't spend a lot of time in the exam answering 200 plus questions. So the book I recommend for that is this one. The link, it's basically La Charity, Priority, and Delegation. I'm gonna put a link to the book in the description. That's pretty much what I used, pretty much for my priority questions. So you have to know that. You just pretty much have to know how to delegate. You have to know how to prioritize. And those are my 3 steps pretty much on how to pass the NCLEX. It's not very hard. Like I said, it took me 2.5 months to study. Never went to school here. Went to school in the Caribbean. I came here and I passed on the first try. I feel like if you can do it, I feel like if I can do it, you can do it too. There are many people who've like asked me to help them out. I've helped them out. If you're having problems passing the exam, please try to contact me. And I'm a personal tutor too as well, and I can help with tutoring one-on-one through video, and we can help you to achieve that goal. Right now it is Sunday, and I worked last night, just coming off a 14-hour shift pretty much, and living my dream of being a nurse pretty much. So you want to be a nurse and come off that 14-hour shift, please continue watching my videos. Like, comment, subscribe. I'm out.